Well, concerns continue to be raised about the safety of COVID-19 vaccines, particularly on social media. Of course, it's despite the rigorous testing and approval processes for inoculations to go public, specifically in this country. We're joined by COVID-19 Ministerial Advisory Committee member on vaccines, Professor Helen Rees. Professor Rees, good evening to you, and thank you so much for your time. If you paid attention to social media at all this past week, you would have seen the hashtags Pfizer, hashtag vaccine side effects trending for a couple of days. And, you know, there seems to be a perception that there's this huge cover-up, a huge conspiracy around the side effects of vaccines. I wonder how you, as members of the medical fraternity, respond to what seem to be, from some people, legitimate concerns about these so-called side effects.
Well, thank you, Kathy. It's very important that as scientists and clinicians that we have this opportunity to talk to the public, so I really appreciate this. And I can as you said, I'm a member of the Vaccine Ministerial Advisory Committee, but I'm also the chair of the South African Health Products Regulatory Authority. So I can put both hats on and really explain how safety goes. First of all, I think that we have to be very careful about social media reports. I think we all know that there are people who don't like vaccines, and there are people who have other motives for putting data out there. But having said that, if there is a question amongst the public about do we really know how safe the vaccines are, then we need to explain that. So perhaps if you give me a moment, I could just explain how we are monitoring vaccine safety in South Africa and globally. So first of all, because these are new vaccines, this is a new disease, we always monitor very, very closely. We monitor all vaccine safety very closely, but particularly for new vaccines. And particularly because we do want to make sure that they're safe and that what we might not have seen in clinical trials that in this case have had tens of thousands of people in them, we might see really rare side effects that occur when you roll vaccines out to millions of people, and we want to be able to pick that up. So what we've done in South Africa is that we have what's called a med safety app. This is an app that both health professionals and the public can have access to. And if people get any kind of side effect or clinical condition after they've had a vaccine, they can report that. We then, all of that data is collected. We also collect data from hospitals, from the health sector. And if we're seeing anything arising that we think could possibly be related to having had a vaccine, then that gets reported to a central place. We then have both the Department of Health, but we have two important bodies that look at that safety. One is the Ministerial Committee that's actually set up to look at vaccine safety. It's called NICEC. And their job is to look at all of these reports and to do what's called causality assessment. What that means is that they say, could that condition that developed after a vaccine have anything possibly to do with that vaccine? Just remember, when you roll vaccines out to millions of people, just because of life, some people will get conditions. We're rolling it out to older people. Some people will have heart problems or high blood pressure or other conditions happening to them, which would have happened anyway and it's got nothing to do with the vaccine. So it's very important when we get any report at all that we do an assessment, and there's a science behind these assessments to see if there could be possibly a cause and effect. The other group that looks at safety together with NICEC and working very closely, meeting every week together with NICEC, is SAPRA, the regulatory authority, because the regulatory authority's role in law is to monitor the safety of all health products and to act if they see a safety signal. So all of that data is gathered from South Africa, but then we feed that into a global data set, which the World Health Organization coordinates, and we get feedback from the World Health Organization. So we, as with all other countries in the world, are reporting any safety signals attached to these vaccines. So it's an incredibly rigorous global effort, and South Africa has really really developed quite a comprehensive approach to developing safety signal, to reporting safety signals.
Of course, when we look at part of what sparked this round of debate or conversation was a document that was said to contain a list of side effects from Pfizer. Well, Pfizer has come out to say that that document is not verified and that it is not their document. Are you, as the Ministerial Advisory Committee, investigating that at all? And wearing your SAPRA hat as well, is that something that you would be looking into?
Yes, I mean, I'm not sure about the status of that document, and I know that the CEO of SAPRA has contacted the company to say what is the status, and the FDA to find out what the status of it is. But as I say, what you'll find is once you start saying, asking people to report if anything happens after a vaccine, some of the things you'll all be familiar with. Many of you will have experienced them. Some people will report, fever or muscle aches or feeling very tired. I mean, these are really not infrequent. A lot of people will notice these after vaccination, and particularly when you have second vaccines or if you have a vaccine after you've had an infection, because the immune response is really kicking in. So those are sort of the things you would expect. As I say, other things are things that happen in life when you're vaccinating millions of people. You're going to have conditions arising. People will get other infections, nothing to do with the vaccine at all. People will have other conditions, medical conditions occurring, nothing to do with the vaccine. And you really must sort out from all of those many reports that you get what could possibly be causally linked. And those are the ones that you then flag and you look out for very closely. So in terms of that report, I suspect, and I haven't seen that report, but I suspect what it's got is that big list of things that happen to people after vaccination, the vast majority of which will have nothing to do with the vaccine itself.
When we look at where we are in terms of vaccinating the adult population in this country, we're still sitting below that 50% mark. And I wonder, when it comes to the questions that people have, it seems that some of the concerns around the vaccine have not been adequately addressed, at least not to the extent that it has left the majority of people in this country comfortable to take the vaccine. How do you think that that can be changed?
Well, I think we should actually look, as you say, if we take the half of our population who hasn't yet had a vaccine, it's not all about people being uncomfortable. Some of it is to do with access. So I think that one of the things that the department is now looking at is how can we increase access. We particularly want to vaccinate those who are at highest risk, the people over 60, the people with what we call comorbidities, other conditions that increase their risk of severe disease with COVID. So some of that is to do with access, and some of it, as you say, is to do with hesitancy. And the majority of people you speak to are they're not saying, oh, we don't want vaccines, full stop, we don't want them for our children. That's not what they're saying. They're saying, we're not sure at the moment. So it is up to us as health professionals to reassure people. The first thing to say to everybody about the vaccines that we currently have available, that is absolutely undisputed, it's globally undisputed, is that all of the vaccines available worldwide that are being rolled out reduce severe disease, hospitalization, and death. All of them. Now, when you get new variants, the level of effectiveness at doing that does alter, but all of them still retain that protection for individuals. So if you want to be protected against severe disease, hospitalization, and dying, vaccination is the way to go. The second thing that we know, and this is worldwide, is that when you have these waves, the people who end up having severe disease and being hospitalized, the vast majority are the unvaccinated. Vaccines protect you against that, and we've seen that in South Africa with the repeated waves. The vast majority of people who end up in hospital who are severely ill are the unvaccinated. The third thing that we should just bear in mind is that COVID infection isn't only about severe disease. A lot of people are now getting longer-term problems as a result of COVID, whether it's with breathing, whether it's with concentration or fatigue. These are not uncommon that people are reporting that go on for weeks and even months. And it's an area of clinical medicine that's getting a lot more attention now. So there is no doubt for anyone who's hesitant out there that the benefit of vaccines worldwide and in South Africa far outstretched from the risks. The other thing that everyone should bear in mind is that we've all got a little bit, Omicron, are we getting towards the end of this horrible COVID-19 pandemic? Well, we would all hope so, but we really don't know that. And we don't know if the next variant we get, and every time we've had a variant, we all know we've had a huge wave. We don't know if that's going to be worse in terms of causing severe disease. And so what everyone wants to be is to be protected into the future. And the way to do that is through vaccination.
Professor Helen Rees, let me thank you so much for your time tonight. She's a member of the Ministerial Advisory Committee on COVID-19.